A vivid look at COVID-19 and vaccines. I'm Rita White Ross, health advocate for the City of Garland. The presentation overview includes COVID vaccine information, priority for vaccination, mRNA technology, vaccine safety and monitoring, signs and symptoms of COVID, and the difference between COVID-19 and other seasonal ailments. The current COVID-19 vaccines that were authorized for emergency use include the Pfizer and the Moderna. The Pfizer is 95% effective, Moderna 94.5% effective. Both are messenger RNA. Both include 2 doses. The side effects are very similar: fever, headache, and muscle aches. And you must wait 15 minutes after the vaccine has been administered to make sure that you're not having a reaction. So what are messenger RNA vaccines? So messenger RNA, they carry genetic material that teaches our cells to make a harmless piece of the protein found on the surface of the SARS-CoV-2 virus. The cells display this piece, spike protein, on the surface, and an immune response is triggered inside our bodies. So this produces antibodies to protect us from getting infected if the SARS virus enters our body. The DNA messenger vaccines do not affect our DNA. It does not enter our bodies or cell nucleus, and it cannot give us COVID-19. So this new technology, but it's not unknown. So mRNA vaccines have been studied for influenza, Zika, rabies, and the cytomegalovirus. The priority for vaccination include phase 1A, and that includes healthcare providers and first responders. Phase 1B, age 65 or age 16 and greater with chronic conditions. Some of the chronic conditions include hypertension, high cholesterol, arthritis, heart disease, heart failure, diabetes, chronic kidney disease, Alzheimer's or dementia, depression, or COPD. So always check with your healthcare provider, and they will notify you and inform you which category you could be in. The coronavirus symptoms include fever, cough, shortness of breath, headache, fatigue, or muscle aches or body aches, loss of taste or smell, sore throat, nausea, or vomit, diarrhea. You may have maybe only 1 or 2 symptoms or multiple symptoms. Prevention, which is very key, is to wash your hands with soap and water or either hand sanitizer for at least 20 seconds or sing the happy birthday song. Please do not touch your eyes or nose or mouth with unwashed hands. Remember to practice social distancing at least 6 feet apart. Do not eat raw food, so thoroughly cooked meat and eggs. And avoid contact with animal products. Travel advisories: always call the airline prior to airline travel. Do not travel to affected areas. Don't travel if you have a fever or cough. And if you become sick while traveling, please seek medical advice immediately. If you feel sick, please stay at home. Avoid contact with others. Cover your mouth and nose with a tissue or elbow when you cough into your sleeve, and please dispose of those tissues. Wear a surgical mask. Keep objects and surfaces clean. Sometimes the symptoms between COVID-19, allergies, common cold, flu, or COVID-19 may be similar. So we're going to break it down. If you have aches and pains, typically that could be a common cold, flu, or COVID-19. A cough, possibly you may have a cough with allergies, but typically your cough includes if you have a cold, flu, or COVID-19. Stomach issues or diarrhea, it's typically with flu and COVID-19. And especially like with children, when they get the flu, they may have stomach issues or diarrhea. Fatigue is possible with allergies or the common cold. But typically with flu and cold, you may feel tired and fatigued. Fever is typical with flu, or the COVID-19 vaccine. Headache is possible with allergies, and it's typical with flu and COVID-19. Recent loss of taste or smell is possible with allergies or the common cold or flu, but it's very typical of one of the symptoms of COVID-19, and sometimes that may be your only symptom. A runny nose is possible with allergies, common cold, the flu, and possibly with COVID-19. Shortness of breath, you may have that with allergies or COVID-19. Sneezing is possible with allergies or the common cold. And sore throat may be common with the common cold, flu, or COVID-19. Always check with your healthcare provider if you're having any symptoms and ask for their advice. Vaccine information. I encourage you to daily check the Garland Health Department webpage. They are currently collecting names of persons to register them for the COVID-19 waiting list. Vaccination events will not be scheduled until additional vaccine supplies have been received. COVID-19 vaccine is still in very limited supply, and they have been prioritized for phase 1, which is healthcare workers and first responders, and phase 2 is for age 65 or older for those who have underlying medical conditions. To register for the vaccine with the Garland Health Department, you need to be in phase 1 or phase 1A or phase 1B and be at least 18 years old. So residents or employees of the city of Garland, Rolette, or Saxe. The vaccine is free. COVID-19 vaccines are voluntary. Garland Health Department strongly recommends all eligible persons to register to receive the vaccine. For those receiving the COVID-19 vaccine, you will receive an immunization card, and it will be noted in the official MTRAC vaccine record. If you do not have access to internet, please call and register. You can go to the website on a daily basis to receive updates about vaccine availability, vaccine information, and if you're experiencing potential COVID-19 symptoms, you can always check with the CDC for resources and guidance for what to do if you are sick. The City of Garland Health Department updates its case statistics as of 2 p.m. each day. As of January the 14th, the total cases were 21,268, which is about 8.8% of the Garland population of 242,914 persons. There are currently 8,150 active cases. 12,934 persons have recovered. 184 persons have lost their life due to COVID and complications. So please, you can monitor the city's Twitter or their Facebook as well for updates. Vaccine information. Registering online is the fastest way to get on the list. If you have family members or friends without internet access, please help them complete their forms. For those who are unable to complete the form online, you can register over the phone by calling the City of Garland's COVID hotline number at 972-205-3900 between the hours of 8 a.m. and 5 p.m. The hotline is currently open 7 days a week. Call volumes are anticipated to be high, so please exercise patience. As we wait for another COVID-19 vaccine shipment, we remind you that each provider who is distributing the vaccines may approach the sign-up differently. You may register in multiple places. If you receive the vaccine through a different entity, we ask that you send an email to the Garland Public Health at gph@garlandtx.gov so that we may remove your name from the waiting list. And you can always call as well, 972-205-3900 to have your name removed from the waiting list. Garland Health Department have utilized their current doses of the Moderna vaccine to vaccine individuals in phase 1, which is the frontline healthcare providers and EMTs, school nurses, long-term care facilities, and their staff. And phase 2 will begin when they get additional vaccines for phase 1B, which includes those 65 and older and those who have underlying health conditions when additional vaccine shipments have arrived. While each of us wait for our vaccines, please remain to be patient. It's crucial for everyone to continue to practice personal protective measures to prevent disease spread until the vaccines are widely distributed throughout our nation. Stay informed, stop the spread. For COVID-19 information, please go to garlandtx.gov/COVID-19. Call 211 for resources and services. That number is available 24 hours a day. You can call the Garland Department, 972-205-3900 between the hours of 8 a.m. to 5 p.m. Or you can go to opentexas.gov for additional information regarding COVID-19. Thank you.